Hello, my name is Dr. Julius Bunek from Michigan Implants and Periodontics, and today we're going to be talking about gingival recession, often called gum recession or longer teeth. When patients' gums get longer, their teeth become more susceptible to root caries, sensitivity, tooth wear, excessive tooth wear. The actual tissue can start becoming inflamed and painful. So there's a lot of procedures that we offer at our clinic to address those issues. And actually soft tissue recession is completely reversible with the right techniques. A big trend right now is patients and dentists wanting as much done in as least amount of visits as possible. And everyone at Michigan Implants and Periodontics, all the doctors here are trained in the pinhole technique. The pinhole technique is a procedure that allows us to do someone's entire mouth at once, very non-invasive procedure using synthetic materials. And the patients have very limited post-op discomfort, it heals quickly, and really you can address and fix someone's entire mouth aesthetically and from a clinical and health standpoint all in one visit. With gingival recession, there's different kinds of recession. Typically around your teeth is a collar of gums, and that gum material forms a seal around your teeth. And what happens is that seal breaks away and basically allows bacteria and abrasive materials to start wearing away the tissue. So I always think of gingival recession like the cuff of a sleeve on a sweatshirt. So basically there's two types of recession. One is where you take that cuff and you push it down. And with that type of recession, you actually can loosen the cuff and lift it back up and reconnect it. But there's types of recession where you'll actually lose the cuff or the gingival collar and you just have this mucosa that's around the gum. And that type requires a two-stage process where you thicken the gum and then you would take the gum and lift it back up. After your gingival recession procedure, if it's a connective tissue graft, free gingival graft, or if it's the pinhole technique, the recovery is pretty much the same for all the procedures. Typically you'll have the rest of the day off. Most people can go back to work on the next day. If it's a minor graft, maybe just one or two teeth, sometimes you can actually go back to work the same day if you had no sedation of any sort. Patients often will ask me, what's the success rate of soft tissue grafting? Is it a permanent fix? They need to get it done every couple years. And typically once you have it done once, you never have to have it done again. Your tissue is basically going to be stronger afterwards than it's ever been. It's basically getting your teeth and tissue back to where they were before there was an issue or a problem. At Michigan Implants and Periodontics, we also offer all different ranges of sedation for our nervous patients. You're always going to get local anesthetic, and we give the local anesthetic so you feel it as least as possible. It's really strong topical anesthetic. But if you're nervous about your appointment, we use oral sedation and IV sedation. With oral sedation, it kind of puts you in a twilight state where you're more comfortable during your appointment. And then for those patients that want to be completely asleep, we offer IV sedation, where basically you can show up, we can start an IV, and you can wake up when the procedure is completely finished. Come visit us at Michigan Implants and Periodontics. If you have any concerns with your teeth, or you feel your teeth are getting longer or inflamed or have sensitivity, we'd love to take a look at it and see if there's anything we can do to help you out.